Hi, today we're going to be covering the 6-minute walk test. The 6-minute walk test measures the distance a patient can walk in 6 minutes using their actual assistive device. This is a self-paced test and patients may stop to rest at any point. This test is a submaximal test measuring walking endurance and aerobic capacity. The walking course should be at least 12 meters long with a smooth, consistent surface. There will be 3-meter marks along the 12-meter pathway. There should be 2 objects or cones to indicate the turnaround. A chair should also be placed at the end or middle in case the patient gets tired and needs a break. The physical therapist must have a stopwatch to track time and keep a mental note of the laps the patient has performed. Before beginning the test, the patient should be sitting in a chair, rested. A pulse ox can be used to obtain their vitals in a resting state and used again at the end of the test to reobtain vitals. In the test, don't forget to provide encouragement to your patient, like keep up the good work, you have 2 minutes left. But do not have a conversation with the patient, as this can distract them. Remember, when administering this test, do not walk in front or directly beside the patient, as this may pace the patient or influence their speed and distance they walk. Instead, walk at least half a step behind them. At the end of the test, remember to record the distance covered in meters. We will now discuss the test with the patient prior to beginning the 6-minute walk test. The aim of this test is to walk as far as possible in 6 minutes. You will walk back and forth in the hallway. 6 minutes is a long time to walk, so you will be exerting yourself. You may get out of breath or become tired. You are allowed to slow down, to stop, to rest as necessary. You may stand and rest, but resume walking as you are able. Are you ready to do that?
Yes.
Okay. Walk around the objects at each end of the floor. I'm going to keep track of your completed laps. Remember, the aim is to walk as far as possible, but not run or jog. After reading the instructions to your patient, make sure you have a gait belt on them for safety reasons, and then make sure you check the pulse ox and record the oxygen levels. Then you will say, start now when you're ready, and begin your timer. Now that the patient is finished, they can sit down in the chair. You can retake their pulse ox right here. And then you can count up the meters and distance covered.
Now I will be discussing the psychometric properties for the 6-minute walk test in stroke population. For the validity, the 6-minute walk test has a strong validity for measurement in stroke population. It measures meaningful walking ability and strongly correlates with the VO2 max. The MDC, or minimum detectable change, for chronic stroke is 34.37 meters. For subacute stroke, it's 60.98 meters. The MCID, or minimal clinically important difference, is divided between slow walkers and fast walkers. For fast walkers, it's under 0.4 meters per second, and the value is 34 to 44 meters. For fast walkers, over 0.40 meters per second, the value is 71 to 130 meters. The cutoff score used to identify walking independence after stroke is 304 meters.
Now we will be discussing the 2-minute walk test, which is a measurement of endurance that assesses walking distance over 2 minutes, which can give physical therapists insight to community or household ambulation. When performing this test, an open walkway with no obstacles is best. Try to minimize the amount of turns the patient also takes by finding a long walkway. To measure the distance, a measuring wheel is best to save time, or in this case, a yardstick will work just fine. Assistive devices can be used for this test, but they should be documented. If the test requires physical assistance to walk, then this test should not be performed. At the end of the 2 minutes, have the patient stop and rest. We will now discuss the test with the patient prior to beginning the 2-minute walk test. Now, I will read the instructions for the 2-minute walk test to the patient. Cover as much ground as possible over 2 minutes. Walk continuously if possible, but do not be concerned if you need to slow down or stop to rest. The goal is to feel at the end of the test that more ground could not have been covered in the 2 minutes.
Okay.
Are you ready?
Yes. Lastly, I will be talking about the psychometric properties for the 2-minute walk test in the stroke population. In terms of validity, the 2-minute walk test has a strong validity for the stroke population. The MDC, minimum detectable change, is not clearly established for stroke-specific patients, but in general adult population, it is 15 meters. The MCID, minimal clinically important difference, in the subacute stroke category is 31 meters. And lastly, the cutoff score has limited data for stroke-specific patients. However, for the community walking for general adults, it's 113 meters.